Dyette Feel the Teal 5K is happening this month, Sunday, the 19th of January from QRC. As we know, January is Cervical Cancer Awareness Month, and the Ayana S Dyette Foundation for Cervical Cancer is ensuring that awareness is being raised, and of course, we can get fit and have some fun doing it. Joining us this morning via Zoom is Dr. Vishal Bahal, obstetrician and gynecologist, and also Paige Ribeiro-Agar, director and marketing team lead for the Dyette Foundation for Cervical Cancer. Good morning, Dr. Bahal. Good morning, Paige. Welcome.
Hi, morning.
Hi, morning.
Thank you so much for joining us this morning to talk about this. I know the planning will definitely, of course, be heavily underway. But before we get into the 5K taking place on the 19th, can we just backtrack a little bit, Paige, to the Dyette Foundation and how this all came about?
Yes, so Ayana S Dyette Foundation for Cervical Cancer was really started because we would have lost my aunt, Ayana Dyette. She was only 32 years old to cervical cancer, and this happened in 2018. Now, Ayana's last wish was to share her story so that she can save lives. Because, as we will talk about, cervical cancer is extremely preventable, and we really should not have any women dying from this disease. So, for my family and myself, this foundation really means a lot because we're committed to the education, prevention, and eradication of cervical cancer. You mentioned the 5K, yes, but our main initiatives is really to get into the community to ensure that we can give out the free pap smears, advocate for the HPV vaccine, and really just encourage women to take care of their health on a holistic level.
Something, of course, that is so important. And as you mentioned that, Doctor, let's bring you into the conversation. Good morning again, and thank you so much for joining us. One of the things that, of course, was just mentioned by Paige is the fact that it is preventable, but also, in addition to those measures that you're going to share with us this morning, give us, if you can, very briefly, a summary of cervical cancer and what we can do as women to prevent.
Sure. So cervical cancer is essentially a cancer of the neck of the womb. And it's important to know it is the fourth most common cancer in our country. And in the most recent data, they have about 564 cases over the past 4 years. Simply put, one woman every 3 days would be diagnosed with a cancer, and one woman every 5 days will die from a cervical cancer. So these statistics obviously is very alarming for a cancer where it's totally preventable. So we actually know what causes it, which is the HPV virus. We actually know how to vaccinate against it, which is the HPV vaccine, which is available very widely, both public and private. This vaccine is given to boys and girls from age 9 to 14, and you can actually give this vaccine all the way up until 45 in some cases. The other measure we use, as was mentioned just now, would be pap smears or cervical smears. And this is actually offered in women who are sexually active from age 21 all the way to 65. In some cases, and in the future, we'll actually be doing what we call primary HPV testing. This is actually done in the same manner as you'd have a pap smear done, except we'd be testing for the HPV virus. And this is actually done from age 30. One of the major benefits of doing this is that if you have a HPV test at age 30 and it's negative, you can actually screen next in 5 years. So you don't have to do it every year in some cases, or every 3 years in some cases. And the other measure, like lifestyle changes or looking at the holistic health, things like eating right, stop smoking. In some cases, men using barrier contraception when they're sexually active. This will also decrease the risk of having a woman contracting the HPV virus.
Doctor, in your experience, would you say that there is still a stigma attached when it comes to women coming into being tested and even being vaccinated?
Definitely. So when the HPV vaccines were originally introduced, it was thought that by vaccinating boys and girls, we're encouraging them to have sexual intercourse. But it's not true. We need to start thinking of cervical cancer or contracting HPV viruses through skin-to-skin contact instead of looking at through sexual intercourse. We also don't regard this virus as an STD. It is not a sexually transmitted disease like what we'd label some of the other viruses as. So it's important to move away from that and ensure that parents, all women and men understand that this is brought about by skin to skin contact, and women need to understand that this is a preventable cancer, and these simple measures can actually eradicate this disease within our lifetime.
And something, of course, that we see the Dyette Foundation for Cervical Cancer doing, showing that we are raising awareness and also having some sort of participation along the way. So, Paige, we'd like to bring the conversation back to you. Let's talk about this upcoming 5K. Can we have all the details?
Yes. So, unfortunately, we are sold out, but I would like to thank all members of the public that took the time to register, the corporate companies that have shown their support, registered very large teams. Some of the schools got in there, but we are having our annual Field Teal 5K on Sunday, January 19th, 2025. This is happening at QRC from 6:30 a.m. We really dedicate this 5K to the public so that they can feel the teal and really support the cause, because this is one of our main fundraising events where we utilize the funds that we do get from this event to now give back into the community, where we can have the mobile units to give out the free pap smears, visit the schools where necessary, and to ensure that the HPV vaccine is part of our drive. The 5K on the day, we're looking forward to all the vibes, all the nice little goodies that we love to give to the public, and of course, just raising more awareness on that day about this disease, how it can be prevented, how can persons support the foundation, and more importantly, how can women continue to protect themselves and their loved ones.
One of the key concerns, of course. Paige, in addition to the annual 5K that we're speaking of right now, and as you would have mentioned, going into schools, are there any other initiatives or strategies that we can look forward to and learn about from the Dyette Foundation for Cervical Cancer?
Yes. So I mentioned the schools, I mentioned the 5K. I think for us this year in particular, we really want to be bold with our initiatives, because we find that we don't have a lot of education within the public sector still. As you mentioned, there are still a lot of stigmas attached to it. So you would be hearing and seeing a lot of us in terms of education and raising awareness. I don't want to spoil all the surprises that we do have coming up. But definitely stay tuned. Our main thing right now is getting into the communities to make sure that those pap smears are getting done on a regular basis. At the end of the day, early detection can save your life. So we truly believe that getting into our community with our women, we want to be able to give back to you, because we do understand that there may be barriers preventing persons from getting their regular checks. So women may put these things on the back burner, but as a foundation and as somebody who witnessed their aunts succumb into such a devastating disease, we are truly committed to eradication of cervical cancer, because it can happen.
Definitely can. Before we wrap our conversation, Doctor, I'd like to bring you back in for some closing comments when it comes to cervical cancer and Trinidad and Tobago.
Sure. So what I'd like to add is that women, this type of cancer largely is asymptomatic. A lot of women, when they develop this kind of cancer, they don't have any symptoms. But some of the symptoms that can present as well could be abnormal bleeding, abnormal discharge. And what I want to advise the public is that, yes, you need to get screening, you need to get the vaccination. But if you develop any symptoms, you can see a gynecologist early on to have an assessment and an examination. Because even if you develop cervical cancer, we have a wide range of treatment options that include surgery, as well as what you call chemotherapy and radiotherapy. And even patients who have what you call locally advanced disease, you can be cured from just radiotherapy and chemotherapy and not have surgery. So it's important to understand that even if you develop this, it is not a death sentence. You can have treatment and be cured and go on to live a normal, healthy life subsequently.
And Paige, closing comments and also how we can get in contact with the Dyette Foundation.
Okay, so how we can get in contact with us, we are on both Instagram and Facebook at Ayana S Dyette Foundation for cervical cancer. Our WhatsApp number is 725-2733. That's 725-ASDF. And in terms of closing comments, ladies, January is Cervical Cancer Awareness Month. If any other month of the year that you book your pap smear and just try to get things involved, or rather, try to take care of your health a little bit more, let it be this month. Book your appointment this month. Take care of yourself. Fellas, this is not just a message for the ladies. You have ladies in your life, so please encourage your loved ones and your partners to take care of themselves, get themselves screened, and let us eradicate cervical cancer.
Dr. Bahal and Paige Ribeiro-Agard, thank you so much for joining us on the Now Morning Show. All the best as you continue to raise awareness for cervical cancer in Trinidad and Tobago. Have an excellent day.
Thank you.
The 5K registration may be closed, but there's going to be more coming up that you don't want to miss, and there's more coming up on the Now Morning Show, so stay tuned. We'll be back right after this break.